It's time for the Source's weekly check-in with the Medical Officer of Health for the Niagara Region, Dr. Mustafa Hirji. Today is the day that the region votes on a mask bylaw. You have some opinions about the mask bylaw. What is your role in today's meeting?
We may not actually necessarily see a bylaw come out of it, but certainly there'll be a decision of whether we're going down the road to having a bylaw or whether we're not going to go down that road, and that'll be up to regional council to decide. I think my role in this debate is to really bring forward what is the science, what is the evidence, to help explain the issues to councillors so they have that input when they make this important value judgment of where they think the popular will is to go.
Masks is something that you have been recommending, but you've fallen short from saying it should be mandatory.
Yeah, that's correct. And, I think there's a couple reasons for that. I think first off, as you alluded to, washing your hands, keeping distance of 2 meters from others, that's really your first line of protection. That's what actually has the strongest science behind it. And so it seems a little odd that you would then require the second line measure, which is wearing a face covering, yet keep the first line measures, the ones that are more effective, to still be voluntary. The other part here is that I'm always very focused on that public health decisions should be made based on the best science and public health research that's been done. There's certainly some growing evidence that face coverings are having an impact in some countries in slowing the spread of COVID-19. And in recognition of that, we do think it's something that should be recommended when you can't keep your physical distance. But the research at this point isn't strong enough that I think it would justify requiring face coverings, given the relatively low risk we're fortunate to be experiencing right now in Niagara, and given the potential that there could be some harmful effects of it.
How do you feel when you see some of your colleagues in public health in other jurisdictions, Eastern Ontario comes first to mind, enforcing or supporting mandatory masks?
Yeah, I think, it's recognition that this is a gray area. The science, as I said, is building in the area. It's relatively weak, and there's a judgment call of what to do with it. I think the other important part, though, to remember is that we have a system in Ontario where we have local medical officers of health, so decisions can be made locally on what makes the most sense. And so every medical officer of health is ultimately looking at what is the situation they have in their area. Some of the considerations for me, of course, is that we have relatively smaller numbers of cases in some of the other areas that have gone down this road of requiring face coverings, and I think that's an important consideration. Another important consideration is also that we're a relatively more rural area where there is naturally some physical distancing. When I look at a place, for example, to take the most extreme example, somewhere like Toronto, you can imagine in that urban environment it's much more difficult for people to keep physical distancing. And so therefore having a face covering requirement makes some more sense there.
Dr. Hirji, looking at today's numbers, 0 new cases between yesterday and today, but there is a new outbreak that we're waiting to hear about. Is it time to reveal that yet, or do we still have to wait?
Oh, no, you can hear about that outbreak. That outbreak was updated on our Outbreaks page of our website yesterday at about 4 o'clock, which is when we do that update daily of our healthcare facility outbreaks. It's a new outbreak at Tabor Manor, which is one of our local long-term care homes.
So Tabor Manor and Garden City Manor currently with outbreaks, but not in big numbers, obviously, because of the 0 new cases?
Yes, exactly, and not large numbers either, because we've had a pretty good run here, as I've alluded. We haven't had a large number of cases reported on any single day in Niagara. So certainly hope that remains the case and we're able to bring these outbreaks to relatively swift conclusions without many cases being built in them.
Dr. Hirji, there's been some changes to the dashboard, the statistics on the public health website. It used to be all the data was on 1 page. It's now moved to 4 pages. Can you take us through the changes?
As we get more data and there's more cases, we're able to start breaking down our numbers to provide a little bit more insight into people. We also recognize, though, that there's lots of numbers and maybe not everybody is as much of a statistics head as I am. And so we've actually broken things down into 4 separate sections. First off is we have an overview tab where we just have the headline numbers. How many cases have there been? How many active cases remain? How many deaths? How many outbreaks? We have a tab then where we go into a little bit more detail on our cases. So you can see the municipal breakdowns. You can see breakdowns of how many cases have been from outbreaks versus elsewhere. You can see some of the age and sex distributions. As well, you can see what is the type of exposure that has led to cases. Have cases just been from travel? Have they been in close contact with others? Have they been cases where we don't know the origin, which we consider to be community spread? We then added a new page with some new data on outbreaks. Outbreaks constitute about 54% of the cases that we've had in Niagara, so it's a big part of the story here. So we've provided some of those kinds of breakdowns of what kind of outbreaks are they, is it staff versus non-staff we're getting in, what are the age groups, and again, the gender breakdowns. And then finally, we have a page where we try to show some of the details on how the outbreak in Niagara overall is tracking.
Thanks for that clarity. One final question. How is Niagara doing in your opinion? Now we're 3 weeks, I believe, into phase 2.
Yeah, we're just getting close to that 3-week point, which will be Friday. Thus far, I think, there's the positive news is that we're not really seeing any uptick of cases. So that's absolutely the most important detail. One thing that is a little bit concerning to me, though, is you do see, I think, people are becoming a little bit more complacent with keeping 2 meters distance from others. They're getting a bit complacent about not regularly wearing that face covering if they're in a crowded mall or a crowded store. Totally recognize it's been a tough few months to get to this stage, but I think it's really important that we don't let our guard down now. I think we're doing really well, and that's thanks to everybody's efforts to, practice those behaviors. But if we let our guard down, we don't want to be in the place where we're seeing in the southern U.S. and western U.S. as well, where they're starting to see large increases of cases. We want to stay on the good track. We want to be able to move to stage 3 in the coming weeks and hopefully continue to have low cases.
Thank you very much, Dr. Hirji, and we'll give you your freedom to say goodbye, and we'll talk next week.
Sounds good. Always appreciate being on.